Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers Podcast. Excited to be sitting here with Julia Komissarchik. Julia is the CEO and co-founder of Glendor. Julia, thanks for spending time today.
Thank you for inviting me.
Tell me about, let's just dig into Glendor. What is Glendor? It's a great name, by the way. Love it.
Thank you. Yeah, I'm a big fan of Lord of the Rings. Actually, why don't I make an introduction of myself?
Sure.
So my name is Julia Komissarchik. I'm CEO and co-founder of Glendor. My background is AI. I have 20 years of AI under my belt and 10 years patents. And I have a degree in mathematics from UC Berkeley in California and a degree in computer science from Cornell University. So that's about me. Glendor has been founded in 2017. And what we want to do, what we would like to do, is to empower data sharing while protecting patients' privacy. So let me tell you why it's even important. And the story is a little bit longer, right? So we are very excited, we as a community, very excited about AI breakthroughs, especially AI breakthroughs in healthcare that are very much needed. But unlike other industries, in healthcare, the training data and testing data is not just some publicly available bits and bytes. It's actually somebody's very sensitive, very private medical records. So in order for this information to be accessible for AI training or for any kind of research, it's very important that we de-identify it, thus protecting patients' privacy. So that's where Glendor comes in, because our focus is how to easily, for the users, de-identify protected health information, which could be the names, anything which will lead back to the patient from medical data. And medical data could be medical images, PDFs, voice recordings, videos, lots of different so-called multimodal data, and how to de-identify it, how to make it easy, how to make it automatic, and how to make it as secure as possible, which in our case, what we do is we make sure that the software is run by the data custodians. So we as a company never have access to the data, only the data custodians have access to the data and they process the data. So that's about us.
Got it. And
any questions?
Yeah, who are your clients?
Well, we work with government entities like NIH. We work with large hospitals. For example, Emory University, they published a 3.4 million with an M images data set on AWS Open Data Initiative. And that data set was de-identified using our software. We work with labs, pharma. Basically, it's anywhere the data, medical data, has to be moved from point A to point B, and you would like to filter it out so that the patient's privacy is protected.
Got it. Have you seen the Epic Cosmos?
No. I'm sorry, what is Epic? Oh, you mean, I'm sorry. I was thinking of something like a movie. Yes, I'm familiar with it, but not as well as I would like to. Sorry, I was thinking of, like Cosmos as in Carl Sagan's movie or something like that.
No. It's a massive data link of de-identified patient information across, the entire country. They're trying to get health systems to buy in to it and provide the data, and then they can then access the entire data lake and get like patient lookalikes and get information on and look at patterns and do a whole bunch of different types of training. We just did a LinkedIn Live about it with a couple of interesting guests from healthcare.
Yeah. So it's and that's actually raises the most important question, right? Glendor, what we do, but most importantly, it's very important to have as many data lakes as possible. And here's why. If we don't have highly diverse, highly representative data lake, any data which will be trained not on something like this, will be any models, will be non-generalizable and biased. Also, it's very important to have multimodality. And by multimodality, I mean not just medical reports. Also X-rays, CT scans, MRIs, videos for example, orthopedics, right? Photographs, dermatology, voice recordings, for example, for mental health. So it's very important to have it, first of all, across the demographics, across the country, but also across the modalities. So Cosmos is, Epic is much bigger than us, but I would say Cosmos is a nice next step for it. But I think there is a lot of more work that needs to be done.
Fair enough. So kind of going back to the beginning, what did AI look like 20 years ago when you started? And kind of from your lens, how has the industry progressed? Obviously, everybody all of a sudden knows about AI because of generative AI and ChatGPT. But talk to me a little bit about the landscape and the progression of the industry over the last 20 years.
Well, AI has been going up and down, right? So everybody gets excited about it, everybody very excited, and then everybody is disappointed with it. The best definition of AI I've ever heard is the following. If we don't know how to do this, it's AI. If we do, it's mathematics.
Huh.
So, but when I started, it was fundamental technologies like OCR, optical character recognition.
What is that?
Would have been under AI. So let's say you want to recognize a piece of paper with lots of texts in it. That's OCR, optical character recognition. What it does, it identifies individual characters, but then you have to have additional things like NLP, natural language processing, on top of it to be able to collect it into sentences and understand it. So there's what for speech recognition, where how do we recognize speech? Once again, fundamental technologies. Now, a lot of work is done on applications. It's not the question, and a lot of AI now is perceived as models, machine learning or deep learning, LLMs, etc. So right now, in my opinion, the focus is how do we train the best models, but we don't necessarily change the model types that much. Having said that, LLMs are different, but most of it is who has the access to the resources, as in computers, and who has access to the data. And access to the data separated the haves and have-nots. Because if you don't have access to really good data, your models will be toy models.
Right.
They might perform really well on the existing data set, but once it goes out into the real world, it fails. That's why, going back, that's why our focus is how do we empower AI community to have access to the data? How can we make it so that hospitals are comfortable sharing data? Because it's really scary, right? There are legal implications and fiscal implications because it's HIPAA, but also it's very scary because there's reputation damage.
Right.
If the patients know that the data is incorrectly shared, then there will be a lot of problems.
Right.
So that's why it's less sexy than other applications, but it's actually something which is fundamental, something that we really very much need to do. That's why, for example, we're seeing a lot of activity in the government and commercial sector in terms of how to create those data lakes. Going back to the cosmos.
Right. I don't know if you can speak to this, but everyone feels like the models that are available now that everyone's using are going to be commoditized down to the bottom. So AI is like on a race to become cheaper and cheaper and cheaper and cheaper and cheaper. And obviously by AI, I'm talking about specifically tokens from these models. I heard another argument that actually it's going to be the opposite because it actually costs like billions of dollars to build something the size of ChatGPT or Claude or, whatever it is. And right now they're actually losing money every time someone is using it. And they're doing that to basically get market share. But then they're going to price everyone else out of the market. And then it's actually going to go all the way up. Do you have any insight onto where that's at?
Well, my insight for what it's worth is it will all be determined because you were just discussing the fact who will have access to the hardware to train those models, right. And then will it be possible to pass that cost to the users? But I would say there's also another dimension which is orthogonal to this, and that is data. Who would have access to the data? How can we democratize the data? Otherwise, only very large silos, very large companies who can afford to purchase the data will be able to train their models. So it's slightly different direction. Same principle, but here when you're talking about data, then it becomes like who has the biggest pool, right? Who can have the data, but also who can have access to the data. Would the individual companies, small companies, be able to do this or not, or individual developers? Because my strong belief, if we enable this access to the data, then we will be able to. There will be a lot of different models that will be trained. There might be the same type of model, but I mean different use cases. Because we haven't even discussed this, right? There's the model, which is like fundamental model, but how do you apply it? Because it's very like when you train systems, it's also, you have to keep in mind what use cases you're doing. And in healthcare, you have to be very particular. It depends on what you're taking care of, what you want to automate, etc.
And talking about the actual data for a second, as generative AI creates more and more and more new data and synthetic data,
Yes.
Is that on, like, I don't know, the back end or whatever, but like, is that actually, like, can you differentiate between true data and AI created data, or is it just going to become one giant homogeneous pool of data?
We have to differentiate, and here's why. First of all, generated data, it's just rehashing of the old data. So it becomes cyclical. So it's very dangerous, because then it will become an echo chamber. But also, I look at it from the privacy point of view. There is an illusion that if you take a data set and you manipulate it and it becomes generative, you can't find the underlying data and underlying PHI, protected health information. You can, and there has been research done. So it would have been nice that if synthetic data can take care of all of our problems, it doesn't. But it does help in certain cases, right? For example,
how do you do that? How do you get the underlying data from the generated data?
That's math, right? Going back to what's AI, what's math? That's math. You can actually recreate the original data from it. Same thing, for example, for federated learning, right? Another thing which is really attractive, and I wish it worked. And that is, let's do this. You're not going to give me your data, right? We'll have different silos, but you will train my model on your data. The problem is that once you give me the numbers, which would look very, very benign, I actually can recreate your data from it if I have enough.
So
once again, research done, etc. I can send you the links to it.
Right. So coming back to Glendor for a moment, what does true data encryption or PHI de-identification? What does that look like?
So it's not actually encryption. So encryption is a different beast altogether.
Okay.
Encryption is the following: I have a data set. It's very private to me. I'm okay with sharing that data set with you. I'll encrypt it so that en route to you, it won't be decrypted by third party, bad or otherwise. But what we're doing is slightly different, which is how do we make sure that, let's say, X-rays, right?
Yep.
Let's say I want to do a model based on chest X-rays to train whether or not somebody had COVID. So for that, you need to have access to my X-rays and my patients, right? And if I can send them to you without revealing who the patients are, you can actually successfully train your model.
Right. Because
you don't need to know that it was Julia or John, or you might need to know gender, but that's different. But you see, you don't need to know all the information about me in order to use my X-rays. Mm-hmm. So that's de-identification. So you see how it's different. Encryption actually ensures that in process, or if somebody wants to access your data set, if it's encrypted, it won't be possible to access it. Mm-hmm. What we're doing is making that data set not needed to be encrypted, because it's no longer, there is nothing there that can be dangerous to reveal.
Right.
Like that Emory data set, 3.4 million images, right? But anybody can access them, and they're benign from the bad actor's point of view. Actually, I'll give you another example. So reportedly, right, in the black market, if somebody wants to buy a credit card report, it costs $1. Okay. Right? The price might have changed. If somebody wants to buy medical record, one medical record, it's $300. And there is a reason for it, right? Credit cards come, go, some people will get better, bankrupt, etc. Medical history, if somebody had a disease in their childhood, it will never go away, right? It will, like, that information will always be applicable to this person. And also the medical record is much more sensitive because you can be blackmailed. There's so many different things that can be nasty things that can be done with it. That's why it's so important whenever data is shared for training, before we share this data, we make sure that it's de-identified. Otherwise, it's dangerous.
What do you think is the most dangerous real-life threats of people stealing other people's medical records?
Well, blackmail, discrimination at work. Think of anything where is there something that you don't want your neighbors to know, or it will be detrimental to you. That's the idea, right? So let me give you another example. All these conversations about somebody breaking into the silo or data silo and stealing all the information, social securities, etc. We have it in healthcare.
Happens every day.
I'm sorry?
It happens every day. I feel like I get a letter from someone else every day that my data was stolen from my parking app, from my healthcare, from Geisinger, from Nuance, from everyone.
Precisely. So the issue is if this data is anonymous, it's much less of value to the quote unquote bad guys. Because what can you do with it? If it doesn't have your social security, if it doesn't have your name, it just lists you as a customer 1, 2, 3, 4, 5. Nobody, value of it goes down the drain. There's other use cases, for example, the one where you lock the data. I'm not a security expert, so I won't go into that, right? But that's what. That's why I keep saying that it's not security. It's something which is parallel. Or even orthogonal to it, but it's something that we need to definitely think about, because once the data is leaked, there's no way to get it back. That's it. So before we share this information, but there's actually the downside of it, and that is everybody's very afraid of sharing their data for research, because you don't know what happens, right? So the hospitals are very concerned about it. And that actually stifles the advancement of AI in healthcare. And that's a dangerous thing to do, because we do need it. If we don't train it on the right data, the AI models will not be useful at all. So it's this balance. And that's what we're trying to, with Glendor, that's what we're trying to break, sort of to have ability, so that the hospitals have ability to share data safely, without damaging their reputation, at the same time protecting patients' privacy.
Yeah. So tell me. So let's dig into Glendor just a little bit more. So tell me about the technology. Tell me about how it's different. Well,
I can give you a pitch. So there are 3 things which sets us apart from everybody else in the market, and that is it's full automatic. Because a lot of times it's a so-called template-based, where if you know where where the sensitive information is, you say, just delete this corner, like if it's an X-ray, right? Whereas for us, it's full automatic. We expect to find PHI anywhere we look. It's also so-called in situ or at source, meaning it's a piece of software. We're not a service, unlike Google and others. Like Google has a identification service, AWS has identification. We're a piece of software which, if you are my customer, you will be running it on your servers. It could be in the basement without internet. It could be in the cloud. But the important thing is data processing will be done all on your site. So you never have to share your data with me for processing, which is actually quite scary. And it's easy to integrate. So that's, from the how do we differ from everybody else, right? But in terms of the technology, that's actually interesting, and something that we've used before in other projects, which is so-called hybrid approach, which is very much like humans do. We don't just rely on one methodology to do things. We rely on a combination of different things, because different methodologies, different algorithms, different models are focusing on, they have strengths and weaknesses. So by combining them together, so-called hybrid approach, you take all their strengths and hopefully overcome each of their weaknesses with strengths of other models or applications or algorithms. It doesn't always have to be machine learning, right?
I was at a conference last week talking about, integrating AI in health systems, and a bunch of people were asking about how to get their teams and their, legal and compliance to be comfortable with trying something, even piloting something. What would your advice be?
Yeah, that's actually a very difficult question, right? Because when you're using somebody else's third-party code, it can create havoc with your system. So we always encourage our customers to try things out, to make sure that they're comfortable with it, that they can isolate and create a border around it so that it doesn't leak into the main system. Having said that, wearing my sales hat, for us, it's not a problem. Both legal and IT really likes us. Legal likes us because we don't need to create BA, so-called business associate agreement, because we never have access to the data. It's all, it's all up to the customer. And IT likes us because it takes about 5 minutes to install and run us, and we don't require internet. We don't do anything except for digest a bunch of files and then spit out the same files, but without the sensitive information in it. That's
wow.
It.
So you don't have to manage your technology at all. You just sell it to them. They buy it. They put it in their systems. And now for the rest of time, they can just de-identify information.
And that was actually a design choice. And that's why it took us 4 years to develop our technology, because it's not easy. It's much easier to do a service where you can always tweak, and everything's done on your servers and you always can tweak with them. Here it goes into you create an executable, you give it to the customer, and then that's it. You never see that executable, right? And unless customer comes back and says we need this and that, we don't know how they use it, and that's by design.
Quite fascinating.
Yeah, it's a sort of taking, not like Google goes this way, right? It's a service, full service. We're going the opposite way, and actually it helps because it makes it for a unique solution.
Right.
And useful. That's how I would like to have my software, so that it's not I don't have somebody looking over my shoulder all the time.
Right. Were there any challenges that came up that were maybe surprising to you while over the years of you developing this? What did you say, it was 4 years?
So, there are algorithmical challenges because what we're doing is difficult, right? What humans can do easily, as in I'll show you something and tell me where the name is. It will be easy for you, even though it may be the name you've never heard, right? But so there are algorithmic challenges. There are also quite frankly technical challenges, because how do you make this software so that you don't have to update it all the time? I know it sort of sounds boring, but that's a very difficult challenge. And by the way, we haven't stopped, right? We're expanding to other modalities. We're improving our algorithms. So this is one of those things where, like in Alice in Wonderland, you have to run really fast to stay in one place, right?
So do you buy the data after you de-identify it to continue to update your new models, or you don't need that?
So that's the tricky part, right? Because for us, what we need is unvarnished data.
Right.
De-identified data is no use to us.
Right.
So that's where it gets very complicated. And that's where, the secret sauce comes in. Because if you have access to a bunch of data, you can train a model.
Right. But you need chicken or the egg problem.
Precisely. But we know how to solve it. And actually, hybrid approach does help. Because then humans can solve this, right? I don't have to show you a million x-rays for you to figure out what the PHI is in that x-ray.
Right.
It will take you like 2-3 at most.
Right.
Same principle.
Really fascinating. So future looking, sounds like you guys are crushing it. What are your goals for what's the next stage? Where does it go from here?
Well, for us as a business, continue selling our software. For me personally, and for my partner is we would love to see a lot of data repositories become available, because I think that's what will help us as a community, as a healthcare industry, to resolve the problems. Because if you look at it, once again, I'm a mathematician. If you look at it from the mathematics point of view, the number of, let's say, radiologists, the number of radiologists is evening out or even dropping because people are retiring. It's very exhausting. At the same time, population that requires radiologists' help, especially with the boom of MRI, all those mobile MRIs, CT scans, etc., is growing. And there's a discrepancy, and it's going in the wrong direction altogether. There is no way for us not to do AI, right? AI is not going to replace the doctors, because at the end of the day, what it can do is heavy lifting. It can take care of the boring stuff or obvious stuff, and then leave the more sophisticated and complicated things to the humans. But without this, there's not enough humans.
Yep. I say all the time, in healthcare, we don't have a patient problem. We have a staffing problem. So patients aren't running out, and it's going to allow people to do more with less. I remember what I was going to ask you. So de-identifying text, I understand. De-identifying pictures. So are you actually are you just removing the name and the text identification of a patient on an image, or are you manipulating the image so it's impossible to track back to the person who's taken from?
So it depends on what we're talking about, right? So, for example, if you're talking about an X-ray, usually it's just it has somewhere in the corner or somewhere, it will have the name of the patient, date of study, etc. So for that, you remove the texts. The tricky part is you don't want to remove all the text. One of the approaches. Let's just remove approach to identification. Let's make the entire image black. There will be no leakage of PHI, but it will be absolutely useless. Same principle. You don't want to delete all the text, only the sensitive thing. That's for X-rays, CT scans, etc. There's also so-called meta tags, and that's another can of worms. And for that is you have standard tags, custom tags. Standard tags are like patient name of the institution. Custom tags, it could be anything that the hospital decides to add to the system, right? All of them needs to be also reviewed, because let's say there will be patient name will be nicely removed, but then it will say a long description about study, and it will have patient name in it. you need to remove that too. So you have to look everywhere. So that's for the medical images. For texts, yes, that's the one that everybody's most used to. And that's, remove the name and everything else. But think of that. Think of the videos. Let's say it's a hospital video, right? Then you have to identify faces. You have to identify any kind of tags. You have to identify anything which is behind, like whiteboard with all the names on them. You have to de-identify fingerprints because at certain light you can actually copy it, right? You have to de-identify tattoos.
So are you just blurring them? What's the actual form of de-identification for video?
You blur them, but you have to, once again, you can blur the entire video. Done. Absolutely useless. So you have to be very careful. The biggest challenge is not the blurring part because that's easy. That's like 2 lines of code. It's how do I identify it? How do I make sure that I don't miss anything?
Right. All right.
So that's for videos.
What about voice?
Yeah, same thing. Same thing. Like report on or interview with a patient, right? They could be they might be referencing their own name, their relatives' names, job they have, location they're at. All of this is also sensitive because at the same time, there is the voice is very important, for example, for mental health, because there's a way to detect, interviews with the psychiatrists are very, patient-psychiatrist conversations are very interesting and useful because they say so much, but they have to be identified. Now,
so are you blurring the words and keeping the tone? What are you actually doing to that audio?
So there, what we do is and it's up to the user what they want. It can be silence. It can be beep, 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 like in TV they do.
So anytime there's anything sensitive, but what about the actual voice? Can you take voice recognition and find the person?
That's called voice recognition, right? It's sort of speech recognition, voice recognition. Yes, but then if you take that out, then the data becomes useless. So there's always this. That's the thing with identification in general. It's always sort of border case, right? How much do you take out? Let me give you an example. Dental X-ray. Dental X-ray will identify the person, but if you de-identify the teeth, then this dental X-ray becomes useless. So the important thing is to think through those things. Certain things can be de-identified. Certain things have to be still kept under lock and key because they will identify the person.
So can you take, let's say, would it make sense that in some instances you're taking, let's say, an image of my face, right? And then you're basically saying, okay, for training about ears, we're basically going to blur everything except the ears. Boom. Then take the same picture, and now we're going to do for the mouth, blur everything except for the mouth, and then put that in that file. And then, does it work like that?
I have bad news for you.
Yeah.
I have bad news for your ears. Your ears will identify you.
Right, but let's say now that's the purpose of the study.
This area will identify you.
Yeah.
There are so many points. Unfortunately, face recognition is getting better and better and better. So there are so many points, even if I obfuscate some of the portion of the face, like with masks, right? After COVID, everybody is wearing masks. And we still can identify people. Face recognition can identify people. So it's another one of those very challenging. There's another one which is sort of it's like 99% recognition in the mask. So there's another one which is quite challenging, and that's brain MRIs or CT scans. What it is it's a slice of head. Those slices are really thin. You combine them together, you have a head. Even if you de-identify the name of the patient on that image,
put the head together,
you'll have the image itself.
Right.
So, and for that, for example, there are different techniques. One of them is desculling, which is exactly what it is. You remove the skull in the image. But actually, that means that models or anything cannot work on it because it doesn't have enough reference points for the models to be effective. So-called biomarkers are impacted. So there's also so-called defacing, where you modify the face in different ways. And then it's a fine line between how much is the biomarkers are impacted versus how much of the recognition is happening.
Right.
So that's why, in general, there are certain things which are sort of obvious, right? Remove the names. But there are also a lot of things which are gray area, and they, in my opinion, need to be discussed, need to be thought through. Because if you don't, the horse will bolt, and then it will be too late to close the doors. At the same time, we have to make sure that we do, because without it, all the models will be garbage because they don't have access to enough data. So
yeah, it's such a fascinating concept. Do you think regulation is going to be coming down the pike that's going to be a huge boon to your business, or do you think the government's just going to keep kicking the can, down the road and whatever.
We don't have any choice. We have to think through this. That's why, for example, there is a lot of different conversations about responsible AI, about how do we protect privacy. I think it's something that we as a society need to talk through, and the government needs to look at. In terms of how quickly they will do it, who knows? But it's one of those things that nobody necessarily wants to touch, but absolutely have to go through this.
Right. Fascinating. Wow. Julia, this is the second time I'm speaking to you, and each time it's really fascinating. Thank you so much for spending the time. Where can people find more about you?
Well, on our website and on my LinkedIn. Our website is glendor.com. And also feel free to reach out to me. My last name is difficult to find, so rare, so it's easy to find me on LinkedIn.
Yeah. It's hard. Yeah. Wonderful. Julia, thank you so much. Appreciate it.
Thank you.
Best of luck.
Pleasure. Bye-bye.